Good morning or good afternoon to everyone. First of all, thank you all for being here, and we hope you find it good, this webinar of UCARE for you. Today we're going to talk about different types of induced urticaria. My name is Dr. José Ignacio Larco. I'm from Lima, Peru, and I am a member of UCARE. So, our faculty today, we will have Dr. Natasa Teovska, Mitrevska from Remedika General Hospital at Skopje, North Macedonia. We also have Dr. Alice Kiefer from Charité University Berlin Institute of Allergology, and also Dr. Sophia Neisinger, Charité Universitätsmedizin Berlin Institute of Allergology. The different topics we will talk today in induced urticaria. Dr. Natasa Teovska will talk about cold urticaria. Dr. Alice will talk about Alice Kiefer, will talk about solar urticaria, and Dr. Sophia Neisinger will talk about cholinergic urticaria. I will do a little introduction. First, we have right now involved 16 different countries around the world. Maybe in the last hours we have other countries, so we hope you enjoy this. Please feel free to ask any question you have on the chat, and we will try to answer all of them. So first of all, urticaria, we guess all of you know it, but it's the presence of hives, itchy hives, in different types of the body. You have to remember that these lesions usually don't go out, they don't stay there for more than 24 hours. And sometimes it is also accompanied with some angioedema of different parts of the body, and this usually goes on for 48 to 72 hours. There can be only angioedema, only hives, or angioedema and hives. Angioedema is swelling, right? And we have different types of urticaria: acute urticaria, chronic urticaria, which is when the symptoms are daily or almost daily, more than 6 weeks. And this one is divided into spontaneous urticaria without any type of obvious external trigger, and also induced urticaria, which is the one we are going to talk today. And these ones the symptoms are induced by specific triggers. Which type of triggers? Well, we have physical triggers and other type of triggers. In physical triggers, we have cold urticaria, delayed pressure urticaria, heat urticaria, solar urticaria, demographic urticaria, and vibratory urticaria. Other types of triggers: aquagenic urticaria, cholinergic urticaria, and contact urticaria. Today, we're going to talk about 3 of them, which are very important. So, without more preambles, you can use this QR symbol to connect and see our social media and see other talks we have had before and the ones that we are going to come next. And we have one question. We have a couple of ones also that they have been answered already in the question and answers, but there was a question in the chat about if there is any specific diet. I think it's a very open question that it can be answered in all of these different urticarias we have talked about. So if you can try to be very brief in your answer, please. Sophia, maybe you can begin.
Yeah, I mean, so now specifically in cholinergic urticaria, in general with urticaria, we always say there are no restrictions to food. But some patients do say that there are triggers. For instance, with cholinergic urticaria, it is spicy food. Of course, patients who are suffering from cold urticaria should be very careful with, for instance, drinking cold drinks. Yeah, but there's no specific recommendation on a specific diet. Maybe, I don't know if the others have some other insights there, but.
Yeah, thank you very much, Sophia. Yeah, the diet question is actually, important, but very difficult to answer specifically. And yeah, also in my outpatient clinic, I get a lot of questions about, because of course you as a patient, you can do and change something by your diet. There actually, to really give you as a patient a good recommendations, there should be studies about it, because now it's reports, it's personal reports, and we take them serious. So if you have the feeling, and also tell this your doctor, if you really say this food kind of, if I eat this and then I go out in the sun, then I get the symptoms. If I don't eat this or that, then it's not going to be worse. In solo Urticaria, it's also a little bit a special case, because there are some drinks, for example, tonic water. This can lead to a kind of photosensitivity reaction. So actually, it could kind of be a differential diagnosis. So this is obviously something that needs to be discussed, that needs to be asked. And if you are unsure and you're kind of feeling I cannot eat anything or this and that, then do a kind of a food diary. And if you go to the appointment, show this, I eat this and this, and sometimes there are really some things that appear really. And of course, this then should be, kind of not be taken anymore. But to give you all a clear advice from the start, don't eat this or that or this not. It's from this point now, it's not really possible.
Yes. Leah, I will mention that, yes, one more for the diet is the same. We have always the questions from the patient, what should we eat? Is the food a trigger for urticaria? Of course, we have to follow the guidelines. We have to follow the science about food intake. I'm more concerned about food attitudes that is more like allergens than the food. So, of course, there are patients who are following this advice, like low histamine food, like gluten-free. But of course, we are focusing more on the scientific approach, more studies. And just for the cold urticaria, the food, of course, is something that we have to take care. So cold drinks, cold food, anything which is related with, which is freezed, that has a temperature that can produce urticaria, yes. But the diet, the food, for me, I will follow the science, I will follow the studies. Only the additives that is can be, for me, the allergens for urticaria. So we have to follow the, sometimes, patients are asking us, should we, not eat too much tomatoes, like cereals, or, how to say, hazelnuts, that maybe will, if I stay on the sun or if I exercise, is this gonna make more reaction? Of course, for me, it's, we always say, we put on the, we just, how to say, we follow the patient individual, and we ask about the food intolerance when they were a child, they were young, when they were children, and of course, for me, especially for the cold urticaria, just the intake of the cold food, cold drinks, and this is the only thing that will provoke, that will trigger urticaria. So,
thanks, Natasha. Here is a question for Sophia of cholinergic urticaria. It's a patient that says that She was diagnosed of cholinergic urticaria in 2020 and have been taking antihistamines twice a day, 180 milligrams of fexofenadine ever since. She says she has never had a review and that don't have symptoms daily now, but I'm not sure if this is because I'm taking the antihistamines. Should I go back to the doctor for a review, as I don't want to take antihistamines if I don't need them?
Yeah.
Maybe the question is more about how much time this cholinergic urticaria will be active or not, on how much time they can use the treatment.
So it's a very good question, and it's very individual. But because actually we don't know when the urticaria comes and when it goes. You should definitely try to go down with the antihistamine. Yeah. So from twice a day, maybe to once a day, of course, after talking to your physician, and then check if the urticaria comes back, and maybe just also after a couple of days go off the antihistamine in total. If it comes back, you can always start again. Yeah. So there's no known rebound effect that it comes back stronger or something like that. So I would really recommend go back to your doctor for a review, talk to him if you can stop it, and then just give it a try.
Thanks. Here's another question for the panel. It's from Alejandro Berardi. He says, "Hi everyone, a 30-year-old male patient who came complaining for itchy wheals and flares after taking a bath. It doesn't depend of body or water temperature. We have performed the bucket of water immersion test of his forearm with negative results. He goes well with antihistamines. What should I do to confirm aquagenic urticaria?" Someone with experience with aquagenic urticaria, or what do you think?
Well, he has to do, of course, if he has this test temperature device. If not, then the simple ice test for 5 minutes of the patient. But please, he has to put him off from the antihistaminic and for 7 days, and then to do the testing. If it's a positive one, then this is of course, cold-induced urticaria. If not, he has to do something, as I previously discussed, all this blood counts, everything which is that he may refer that this is the cold-induced urticaria. So first the cold simple test, and then ice test, and then or if they have the temperature test device, then this will be fine for diagnostic procedure. After 5 minutes application, 10 minutes waiting for the results. If it's a positive, then it's the cold-induced urticaria.
And the aquagenic urticaria is a very, very rare form of the urticaria. So I totally agree with Natasha to first go with the other diagnoses, and if those tests really are negative, try to confirm the aquagenic.
Okay. There is also a question that I think you have already answered, Leah, but I want to do it if everyone want to hear it. So they were asking if they have any preferable antihistamine for solar and cold urticaria, and maybe also for cholinergic urticaria. If you have any antihistamine that works better for you.
Yes. So if the standard, like I usually start, as already answered in a question, with cetirizine or loratadine. But if they do not work, I have actually best experience with rupatadine. However, some patients respond to fexofenadine as well, or ibastine. So this is something, I think it's a little bit individually, but from also reports and what other doctors report, rupatadine seems to be yeah, an antihistamine, if the rest doesn't work, this can do the job, kind
Yes.
of.
I agree also with Leah. We have flurupatadine for almost 6 months, and what we can experience so far is I prefer to give flurupatadine as a first drug for as antihistaminic, because we don't have omalizumab for as a therapy. So far, we have all this antihistaminic, but when rupatadine came, we have a very nice results with the patients with urticaria. So the same as Leah.
Okay. There are some questions still there in questions and answer. I will ask the panelists to please answer them by the chat, because we are right now out of time. I really thank you for these excellent talks, and I hope our patients have benefited of them. And we wait you all for the next UCARE for You webinar, and we'll see you.
Thank you, José. Thanks, everyone.